Hi, I'm Dr. Leela Mohan. I'm MBBS MD, General Medicine Physician. I have my own center called as Padithem Healthcare, which is located in HSR. So being a common man, how to understand your lab reports? Definitely you can go through your lab reports, but you cannot understand completely without assistance of healthcare profession, and you cannot take decisions also on your lab reports, but you can go through your reports and you can understand your levels, and you can take decisions what to be done. So there are certain simple steps which I will tell you. So the first, obtain the complete copy of your lab reports, whatever you would have been requested for the test. Like for example, if you are going for a complete health check, there are certain parameters are included in the complete health check. First of all, make sure that your name is mentioned correctly in your report. The age, address and the time of collection of the sample, all those things has to be monitored properly by you. So you should avail the reports completely before going through it. You should make sure that you had received correct reports of you, and then you should go through cleanly into your reports. You need to spend a lot of time into that. It's not just that you had got the reports and you had gone through and you had thrown away your reports. It's your health. So literally you have to spend time a lot for that. More than a half an hour or an hour you have to spend for going through the reports. In your reports, definitely the reference ranges are mentioned in your lab reports. Example, I'll tell you a normal blood test which usually everybody will be doing. That is called as complete blood count. In complete blood count, there are 10 to 20 parameters which are included. Example like WBC count, leukocytes, eosinophils, monocytes, lymphocytes, platelet count, hemoglobin count. There are MCV, MCH. There are a lot of things which are there in the report. So mainly when you go through your values of this, you need to check the reference values. Like example, there are different values for different population. Like now if it is female, the hemoglobin values are 13 to 16. If it is male, if it is above 15 to 17, like that. There are reference range which is mentioned in your lab reports. So definitely you should go through the reference range first, and then you have to see your values whether they are normal or abnormal. So once you go through your lab reports, whether it is normal or abnormal, you should not search in Google or in the internet, all those things. Definitely you should go and meet your doctor or your family doctor, or discuss with your healthcare professional, or if any of your family known people. Nowadays in each and every family, almost here or there, one or the other doctor will be there. So you can ask them friendly when if they are very close to you, and you should not depend upon their reports or their advices. You should go directly meet your doctor in your place, in your city, wherever you are staying near to your house. Go to that doctor and talk to them about your reports, whether they are normal or abnormal, and you should never take the decisions. So there are certain common lab tests which usually we will do. That is nothing but, as I already said, CBC, that is called as complete blood count, or at some parts it is called as CBP, it's called as complete blood picture. There are certain tests which are included in that, and there is a test called as LFT. LFT is nothing but liver function test, which will show total bilirubin or direct bilirubin, indirect bilirubin, your SGOT levels, SGPT levels, albumin levels, and AG ratios. There are a lot of tests which we will do, depend upon the particular disease what we suspect in the patient. And another common test what we do is RFT, that is called as renal function test, which mainly include your electrolytes like sodium, potassium, chlorides and all. And there is a certain test called as serum creatinin, which also helps you in defining your kidney health. Serum uric acid, and then levels of urea, blood urea, nitrogen. There are so many tests which are included in your RFT. And there are certain vitamin tests like vitamin B12 tests and vitamin D tests, iron tests. So a lot of tests like lipid profile. Lipid profile contains the total cholesterol and HDL, that's called as high density lipoprotein, LDL, low density lipoprotein, and albumin ratios, globulin ratios. There's so many tests. Lipid profile, as I said, and thyroid profile, that is T3 T4 TSH. TSH is nothing but thyroid stimulating hormone. These are certain levels which has to be known by you regularly. And then 3 months average of blood sugar levels, what we do. That's a diabetes is a very common complication or common condition in our India. And HbA1c, that is 3 months average of your blood sugar levels, and FBS and ppbs, that is fasting blood sugar, postprandial blood sugar. These are the certain common tests which we do in general practice, and you should know, you should be aware of certain tests which will help you in your definitely regular good health.